New Vista with Miss Pinkney.
What's her name?
Pinkney.
Why do we cancel its holiday?
What's in the electrolyte?
It's a holiday. Why we should go? Yeah, it's holiday. Oh my God.
New Vista on Sunday. The sub is Miss Pinkney.
Nobody.
You just
Pinkney.
forgot to tell us.
Huh?
They should give us teacher on
No, we
where.
won't do that.
I have the recorder here.
They should give us teacher
Secret.
for lecture, not for clinicals. Who cares about clinicals? We care about lecture.
You guys, they're just trying to maximize the fee that you have paid for the school. Don't you feel like cheated if they keep on canceling?
Yes, actually I do. I feel cheated when they keep canceling. Just cancel
It's okay.
the theory, you know, because even if you gone, they could provide the teachers. Call somebody.
Oh well, that's an issue right now.
This is what is.
Yeah. Well, okay. So let's go on with the rest of it. Let's just finish as much as we can.
Normal signal in this country.
Okay lang. Abnormal uterine bleeding. Now, as we have discussed, menorrhagia is an excessive bleeding during regular menstrual flow, and it can be blamed from endocrine disorders. Some of the bleeding disorder will be the abnormal uterine bleeding will be menorrhagia and the metrorrhagia. Now, we have described this one already. Well, we will just see what will be the causes of menorrhagia and metrorrhagia. Now, for the menorrhagia, it's the excessive bleeding during menstrual flow, and usually the causes will be an endocrine disorder. So this can be a problem with your gonadotropic hormone. It's gonna read right now. It can be a problem with your endocrine hormone, or it can be an inflammatory disturbances. Now, what is that inflammatory disturbances? Pelvic inflammatory infections, pelvic inflammatory diseases. So, any infection in the pelvic organ, ovaries, uterus, and fallopian tube can cause a patient to have menorrhagia. Now, infections of the pelvic organs can cause menorrhagia. So, your infection of the uterus, infection of the ovary, infection of the fallopian tube can cause a patient to bleed excessively. Now, what else? Menorrhagia can also be blamed from any overgrowth to your uterus. Any overgrowth to your uterus. As I've told you, if there is something attached to the uterus will keep itself dilated, causing excessive bleeding, causing excessive blood loss. So that's menorrhagia. But of course, a patient who has menorrhagia is very much at risk of dehydration, shock, and anemia. Now, that's why if you would compare who is more prone to iron deficiency anemia between male and female, it would be the female. Now, what else? Metrorrhagia. Metrorrhagia is bleeding in between menses, and most of the time, it indicates cancer. Now, metrorrhagia is bleeding in between menses, and most of the time, it indicates cancer. So, if there is in-between bleeding, if you're bleeding in between your mens, that's something that needs doctor's attention. Further evaluation needs to be done to determine early formation of cancer. Now, in the reproductive system, cancer formation will usually be treated by surgery. You take out the entire reproductive system, most of the time there's high rate of cure. Now, but if it's late diagnosed, late management would cause it to rapidly metastasize because reproductive organ is highly vascular. So that's menorrhagia and metrorrhagia. The excessive bleeding, one is during, one is in between. Between has T, so it has to be with a metrorrhagia. So menorrhagia is bleeding during menstruation. So this is the abnormal uterine bleeding. Now comes after that will be your premenstrual syndrome or the PMS. Premenstrual syndrome or the PMS are group of symptoms experienced by a patient just before they have their menstruation, and most of us has this. Most of us have this. Premenstrual syndrome are group of symptoms experienced by a person just before they have their menstruation or just before we have our menstruation. The most common reason behind this will be the hormonal imbalance. Now remember, in 1 month, sometimes our hormone is very high, sometimes our hormone are very low. So this high-low hormones causes us to have an endocrine pituitary affectation resulting to mood swings. Now, what are those mood swings that we can have? We can have irritability, lethargy, and fatigue. Now, usually this is because of the hormone serotonin, including the depression and sleep disturbances. So there will be sleep disturbances, depression, irritability, lethargy, and fatigue, and this can be blamed to the hormone serotonin. Serotonin is actually a CNS depressant.
Just too little serotonin.
Yeah, serotonin. Yeah, if there's excessive serotonin production, this can cause irritability, lethargy, fatigue, sleep disturbances, and depression because it can cause CNS depression. Now, headache, backache, and tenderness or breast tenderness are all because of hormonal imbalance. These are the rest is because of hormonal imbalance. Estrogen, progesterone very high or very low. Now, what causes again your breast to enlarge? It's because of the hormone estrogen. Now, that's the reason why when we are about to have menstruation, sometimes we have the feeling that we are about to menstruate because you would usually say, I'm having breast tenderness, I guess I'm about to have menstruation. Now, that is because once your breast becomes tender, that's the time that the estrogen is very high. If estrogen is high, you would automatically think that your egg cell is starting to mature. So in short, are you safe? Are you safe to have sexual intercourse
During that time?
during that time? No, right? Because since there's breast tenderness, there's breast enlargement, estrogen is high, egg cell is maturing. If you have sexual intercourse, you might end up getting pregnant because egg cell is maturing. So in short, at the stage we're in, you feel your breast is full. Never, ever attract your husband because you're not safe, and if you don't want to get pregnant, you always have to keep the libido level down. Now, therefore, the size of the breast is determined by the level of the estrogen, and estrogen is due to the production of ovaries. So in short, the size of your breast, if it's too small or too big, blame it on your ovary. Blame it on your hypothalamus. So that's your estrogen. Now, what about your progesterone? Your progesterone causes blood vessels to dilate. So if blood vessels dilate, what happens to the blood flow? Increase. What does the blood do? Metabolism. What does the metabolism create? What does metabolism create? Produce heat. So once you have vasodilation, once you have metabolism, speed of metabolism, you produce excessive heat. That's why when you're about to have menstruation, when you touch yourself, you're actually warm to touch. That's the time that you feel so hot. Now, if you feel that you're hot for today, do you engage into sexual activity if you don't want to get pregnant? No. Because if you are warm, progesterone is high, egg cell has been discharged. So in short, if the body is warm, that's the time that you have to withdraw from sexual intercourse if you don't want to get pregnant. Now, this high-low levels of estrogen is the reason why we also have changes or rapid changes in the moods. It's because it affects the mood center of our brain. Now, what else? Your estrogen causes excessive oil production. So if there's excessive oil production, what can it cause? What can it result? Acne formation. So it is the reason why there will be excessive acne formation because of the high and low levels of estrogen and progesterone. So that's the premenstrual syndrome. Now, premenstrual syndrome can be managed with what? Analgesic, because you might have pain. Now, what about diuretic? It's because one of the symptoms of premenstrual syndrome is being congested, being bloated. Now, why? Because once you have premenstrual syndrome, one of the reaction of the body is to retain salt. There will be an increased salt retention. So if there's an increased salt retention, you will also have fluid retention. So part of premenstrual syndrome is retention of sodium chloride. So once you retain the salt, you will retain the fluid. Once you retain the fluid, you will feel bloated. You will feel bloated. You will feel like you have gained weight. So that's the reason why you will also have abdominal distension. So for some people who would have excessive retention, they might benefit from diuretics. Now what else? Premenstrual syndrome. One of it that you can experience is dysmenorrhea. So to prevent dysmenorrhea, you might want to give progesterone because progesterone still enhances blood flow to the uterus. So if there's good blood flow to the uterus, then you will not suffer from ischemia. If you don't suffer from ischemia, you will be free from pain. So hormones can help a patient who suffers from premenstrual syndrome. Now, what else can be given? High in complex carbohydrate to be a source of energy, moderate protein to perform healing process, low in sugar and sodium, but of course to decrease salt retention and decrease weight gain, limit caffeine and chocolate and alcohol because this can further alter the mood of your patient. So again, high in complex carbohydrates to provide patient source of energy. Protein is needed for good healing process of our uterus as it shed off. Low and refined sugar and low in sodium to prevent fluid retention. Limit the caffeine, chocolate, and alcohol because this affects the mood of one person. Now, reduce and eliminate smoking. Smoking would never be able a good nursing intervention. You would never see a nursing intervention encourage smoking every 2 hours. So smoking will always be a negative side on the medical surgical issues. Exercise, adequate rest, sleep, and relaxation will help in stabilizing the mood of one person. So in short, just explain to your husband that the reason why you're smiling in the morning, crying in the afternoon, it's because of the decay process of your uterus. Just understand it's the uterus decaying process. That's the reason why you would usually have mood swings.
Yes?
Sorry, say that again.
Alcohol causing vasodilation. Yes? It's not helpful.
Alcohol vasodilation. I don't really know if alcohol causes vasodilation. What I know is that it can cause CNS depression, but I don't really know if it causes
Little
vasodilation.
bit alcohol. I'm not saying like drink a whole bottle, but little bit
Alcohol?
brandy. It's helping them.
Did you bring it tonight? I'm so tired.
No, I am working all day because I have bills to pay.
Well, you know, for some reason, we girls have our own way of eliminating our own pain. We have our own way of like taking out the menstruation. Well, we will always have our own psychological way of eliminating the pain and bleeding. So that's why exercise, adequate rest, sleep, and relaxation would be a part and parcel of premenstrual syndrome. And of course, support to the client as well. So that's your premenstrual syndrome. You will blame it for the hormonal imbalances. Now let's go to your menopause. Menopause is what? Cessation of menstruation. Now, once it's the cessation of menstruation, there is the normal decline of ovarian function related to aging process. So, as I have told you, once you celebrate your birthday, you add 1 to your age minus 1 to your egg cell. So, you add 1 to your age minus 1 million to your egg cell. This might be menopause might be induced or it might be the normal process of aging. So, what can be an induced type of menopause? What can be an induced type of menopause? What can be as a procedure that can induce menopause? Hysterectomy, removal of the uterus. So in short, if you have surgically removed uterus, it will induce menopause. So in short, it's not only old people that can have menopause, even as young as 50 and 80 and or even 12, for those who have a malfunctioning uterus, they would usually have an induction or self-induced or surgically induced menopause. When a person becomes menopause, can they have a kid? Once they become menopause, can they have kids? No, because menopause means a malfunctioning uterus. Menopause means you're not anymore ovulating. So if you're not ovulating, then you will not be able to support the baby inside the uterus. Now, It's not considered until it's 1 year that you don't have any menstrual period. So how would you know that you're about to have menopause? Premenopausal syndrome would be you are already having irregular menstrual cycle. Irregular menstrual cycle will be an indication that you a patient will about to go to menopause. So again, hysterectomy might be a cause for your patient to have menopause, but aging process is the major issue. Now, aging process involves egg cells starting to decline. Number of egg cells starts to decline. Once there's no more egg cell, then you will have problems with ovulation. If there's no more ovulation, there's no more mature egg cell. Egg cell is required for you to get pregnant. So if you don't have the ovary anymore, then you will not be able to have a baby. Therefore,
How many a year? You said how?
1 year. 1 year.
You said 1 million a year? How many
Well,
cells?
it's just numbers. Well, I'm just saying that you are losing egg cells when you are about to have menopause. Now, in short, once you had one ovary removed, can you still have a baby?
Yes.
Yes. If both of it removed, no more. If one fallopian tube removed, can you still have a baby?
Yes.
Yes. What about if both?
No.
No more. What about if one uterus is removed? Would you have a baby? No more, because we only have one uterus. Okay? So in short, any removal of one part can cause decreased ability to mature an egg cell that can result to induced menopause. Now, once there is decreased ovulation, no maturation of egg cell, what will be the other signs of menopause? Meaning, if you don't have an egg cell maturing, you will also have cessation of production of estrogen and progesterone. From the previous anatomy, what's the purpose again of estrogen and progesterone?
To make vascular the uterus.
To make the vascularity of the uterus, to make you menstruate. So in short, you will stop menstruating. But with regards to the secondary sex characteristic, what does it do to our body?
Makes our feminine hormone.
Like it goes,
The breast becomes formed, full, and enlarged because of that. What else? We
Body
tend to,
shape.
the body shape is there. What else? We produce oil. What else? We produce, we stimulate the skin gland to produce a substance. In short, a decreased estrogen progesterone will cause us to stop menstruating. So there will no be menstruation, no more menstruation if there's no estrogen progesterone. What else? If there's no more estrogen progesterone, a full breast becomes a sagging breast. So a way for you to determine if you still have the egg cell, take a look at your breast. If it's already sagging, then there's an indication that the egg cell is already declining as well. What else?
calcium.
Hair in your face.
Lower calcium.
Osteoporosis.
Oil production. Oil production starts to start to decrease. It indicates you several things. The skin becomes very dry. The skin becomes very dry. Lubrication starts to decrease. When I say lubrication, vaginal lubrication. So if you don't lubricate, then that would cause you to have painful sexual intercourse. You call that your dyspareunia. Dyspareunia is a painful sexual intercourse that can be experienced by a patient who suffers from menopause. That's why sexual activity is not anymore a pleasing activity for older women. It's because of the lesser lubrication resulting to dyspareunia. Now, if the skin becomes very dry, this is the reason why women starts to have wrinkles. So this is also the reason why your patient will also start to have wrinkles. Now what else? If you start to age, low levels of estrogen causes now decreased deposition of calcium inside the bone. Decreased deposition of calcium inside the bone. What causes, where should our calcium go?
In the bone.
Bones. The calcium that we take, the cheese that we eat, the milk that we drink, that calcium should go into the bones. As women, we have a driver that brings that calcium inside our bone, and that's our estrogen. One of the major purpose of our estrogen is to make sure that the estrogen delivers that calcium inside the bone to keep our bones strong. Now, that is the reason why once a patient becomes menopause, loss of estrogen would mean loss of calcium in the bones. So, loss of calcium in the bones is osteoporosis. Osteoporosis. Weak bones, strong bones. Weak bones. So if you have weak bones, it can easily break. So women of old age are very much at risk of fractures. So that's why they are very much at risk of fractures. So if the calcium is not in the bone, then when is the calcium that you have eaten? It's in the blood. If the calcium is in the blood and it's excessive in the blood, who gets rid of it? Kidney. Can the kidney get rid of the calcium? Yes, but too much of those tends to solidify, so it develops into a renal stone. Therefore, have you ever seen a commercial that says once you become menopause, you have to drink a lot of milk? Yeah. Have you seen a commercial that says if you are menopause, you have to drink 2 glasses of milk each day? Well, before there was. I don't know if you were able to. Now, would you encourage your grandmother or your mother that has been menopause, that is already menopause, to drink a lot of milk?
Not really, because they're gonna have.
Because if they drink a lot of milk, then what's gonna happen next?
stones and
They would have stone formation. So why do they need to advertise to prevent fractures? You have to drink milk. It's because if you drink milk, they really need milk. They need that calcium. But our next problem is they don't have the estrogen that will deliver that calcium inside the bones. If you don't have the estrogen, then what will bring the calcium inside the bone?
vitamin D.
Vitamin D?
Vitamin D just helps in the absorption.
Then you have to take the extra.
Wait there on your side.
You have to take medication. They don't have enough money to take the medication. There's a conservative way to deliver all those calcium inside the bone. What do?
Wait there.
Exercise. Exercise keeps the calcium in going inside the bone. That's why bedridden patient tends to have calcium leaving the bones. They develop renal stones. So in short, the best way for you to say to your mom or grandmother, if you don't want to wash the dishes, is the best favor that you would do is give them lots of milk and explain the pathophysiology of menopause. Now again, guys, use your knowledge in nursing to get away with whatever it is that you want. If you don't want to clean the house, you don't want to wash the dish and wash the clothes, tell your mom, you're drinking a lot of milk. I don't want you to suffer from renal failure. Renal failure involves azotemia. Since you're drinking calcium, let the calcium enter your bone. And since you're menopause, you don't have estrogen to deliver that, you have to put it inside your bone with the use of exercise. Washing the house, cleaning the house, washing the dishes is a very good way of exercising. Might as well do it yourself. I will not help you because I care for you. Do that one. You'll be a loving daughter. Do that one. You'll be a loving daughter if you do that. You're just concerned for them, right? So that is your menopause. So menopause, it's of course shrinking of everything. Subcutaneous fat starts to increase, decrease breast tissue, and thinning of hair as well. Now, medication that can be used. Medication that can be used will be your Premarin, Provera. These are just your estrogen therapy. These are just your estrogen therapy. Just be very careful when you are using our hormonal replacement therapy, because hormonal replacement therapy tends to cause hypertension. This can cause hypertension because it can cause vasoconstriction. How many of you have tried using oral contraceptive that would start to have tingling sensation of the hands? Now, this is our indication of vasoconstriction. There are some people, when they start taking contraceptive pills, they would usually have tingling sensation of the hands. This is an indication of vasoconstriction. So in adult, if you do this, at the same time they are aging, there's plaque on their blood vessel, and you're constricting it, then they will have hypertension. Vasoconstriction is a major issue. So it has to be further evaluated if they will really benefit from therapy of the estrogen. And of course, calcium supplements together with exercise. Now, just before you go, let's just discuss the male menopause. No, just before you go home, let's just discuss the male menopause. Now, male menopause is called as male climacteric. Male menopause is described as male climacteric. Again, haired, say that again.
Did you say male menopause?
Yes, male menopause, andropause.
Men, they get menopause too?
Yes, they do menopause. Now again, it's because ovaries produce estrogen, progesterone, and that is just the ovarian cell. For male, there's two. In their ovoid gland, in their testes, there's two. You have your seminiferous tubules and your Leydig cells. Once the male go 55 and older, they tend to have a very functional seminiferous tubules. They still have good sperm count, but the Leydig cells starts to decline in activity. So this will cause them to have a gradual decrease of testosterone levels and seminal fluid once they go at the age of more than 60 actually. Clinical manifestation will be anything that has developed before will start to decrease. So you would not forget, this is how it looks like. Look, let me put it here. So you would better, you would not forget. Now, as we have discussed a while ago, once you go to puberty as guys, as boys, testosterone level causes them to have the changes, right? We have 5 changes that we have discussed. What's the first thing that will change? Enlargement of the, followed by the
Length of penis.
lengthening of the penis, followed by the,
Hair. Voice.
it's the production of hair, deepening of the voice, and
Shoulders.
broadening of the shoulders. Can you just imagine, without looking at your notes, you were able to memorize the changes on the secondary sex characteristic of the male? See how retentive it is? Testosterone. But I find that, what's the process of urine formation? Wait. So this is what's happening. Testosterone level. So once you go to puberty, this is what's happening. You're broadening your shoulder because you're increasing the muscle. Now, once they go to male climacteric, once they go to the andropause, once they go to their menopause stage, everything will start to change. Whichever develop first is the first thing that they will start to lose. Whichever that develop last is the first thing that they will start to lose. So what will happen? Broadening of the shoulder means they would start to have a hunchback. Yes, they would usually have muscle wasting. See how firm their muscle are before. Now they look like very thin. That's broadening of the shoulder, non-broadening of the shoulder. So which means muscle are already degenerating. Muscles are already degenerating. What else? They will not go back to a high-pitched tone, but there will be changes in their voices. It would be more of a soft voice. It would not be as strong and deep as it is. They will have changes in their voices. What else? They will start to lose hair, and it's very more aggressive in male compared to female. Once they start to lose hair, this is the time that they will decrease their size of the penis and size of the scrotum. Size of the not the size of the scrotum, size of the testes and size of the penis. See, you would easily locate the urethral meatus of a 20-year-old male, but it would be very hard to insert a Foley catheter to a 70-year-old male. It's because they would usually have a very short penis, and that is because of the low level of testosterone. Will they have mood changes? Not really, but the psychological effect of not having a good erection will be a problem to a patient who suffers from andropause. There's more psychological effect to female, psychological and physiologic effect to female compared to male. The male, it would just be more of the psychosexual effect of the andropause. Why? They still have the erection, they still have the production of sperm, but they don't have the size anymore. So in short, the psychosexual satisfaction of the male are usually the one, or the psychological sexual satisfaction of the male are usually the one that is very much challenged. For the female, the menopause is usually the one that causes them to have mood swings, but it has more physiologic effects to the female. So this is your male andropause. Yes.
Is this around the time when they would start to experience erectile dysfunction?
This could be the erectile dysfunction to the andropause is not really due to the the erectile dysfunction with the andropause is not really due to the andropause itself. It's usually because of an accompanying condition. Say they might be developing hypertension already, they might be developing peripheral vascular disease. If it's related to this, it might be because of their self-esteem. Now, because of the changes that is happening to them. They are not as masculine, as attractive as before. So that could be the one that is related to this. But most of the time, the non-erection would usually be blamed on some other condition. And it's usually medical condition. And with that erection problem, we'll just discuss that next week. Yeah. So again, next week, we will not be meeting Wednesdays.
Okay,
Wednesday. We'll meet Thursday, 1 o'clock, take the test. I'll give you your study guide, and then you can go home. For those who are remediating, and then the course outline, the new course outline, I will update it later. I'll give it to you next week as well. And then for those who are taking the remediation test for sensory, right? It's the last one that we took, right? Sensory, we'll just do it 8 plus 7, 15, September 15. That would be Thursday of next week.
We're not gonna have a test on it. We're not gonna have the test that weekend of our birthday.
And then again, you will have clinicals on Sunday with Miss Pinkney. I don't want Miss Pinkney to be staying in there.
Oh gosh. You know what? I'm not gonna.
Oh yeah, you know so we have to turn it on again.
We got 2 hours to myself.
And then between the two, we have to swap it over.
You take off our numbers. Shoot us a message on Facebook. Let us know how that goes over. Let us know what they say.
How it goes.
Well, this one will take some time before it turns on. Let's just do it on the faculty room. I have it on file.
We have a new one.
Jones, she gonna be there.
We gotta be there?
Yeah, they have a sub.
No, you don't. No.
Say no.
Can I send a sub?
If we don't know what
Okay, I'll see you guys Thursday, 1 o'clock.
Bye, thank you very much.
you don't have a school either. You have a good weekend.
I had already started making up these hours. I was not. I don't understand why I still got 10 hours for the first month. I got 3 from first module. I don't miss it. How many days did I miss? They just said 1, right?
Nobody going.
I did miss one day.
Let's go.
That one day that I did I have to go. I missed the one day that I went to the
Why?
or something. I have a lot of hours to make.
But if we don't go, they're not gonna send it out to us. You know what I mean?
Yeah, they will. You see how small our class is? They send us all.
Don't give them idea.
They'll make us all make it up.
Your thing is so good.
Oh, who's that? Oh, it's mine, I forgot.
Oh.
This is good.